Happy to introduce Samantha Hillson, who is the Director of Health Promotion at Tompkins County Health Department here in Ithaca. And so I'll turn it over to her.
Thank you. Okay, hi everyone. Thank you for having me here today. I work here at the Tompkins County Health Department, and I serve as the Director of Health Promotion. So today I'm going to give you an overview of the role of the local health department, specifically what our department does here in Tompkins County, but I imagine it's fairly similar to other locations around the state, just to make sure we're all on the same page, and then talk about the changing face of public health for the future, some research and data collection we've done around community planning over the past year, an example of a current program we have that connects to housing, and then some lessons learned and more for the future. So our local health department has 4 divisions. We have environmental health, community health, children with special care needs, and administration. And the health departments really bridge this span across regulatory programs and mandates and education and outreach. So our division of environmental health is probably the most regulatory of our divisions, and I'll try to point out where I see us connecting with housing across the department, but we do many other things too. So environmental health does regulate our public water supplies and wastewater treatment or sewage, and so that directly impacts the habitability of where people are living. And then environmental health also houses our mandated lead program. And then community health has our maternal and child health programs, and so we have community health nurses who are going out and doing home visits on a daily basis, and often serve both in community health and children with special care needs almost as case managers or care managers, to coordinate some of the different issues and challenges that residents are having. And so that might involve housing, transportation, and other issues. So we also have the lead program is also housed in community health, and it works across both of those 2 divisions, environmental health and community health. And so the laws that Katrina was speaking about, that's when we have a child with an elevated blood lead level, that is when our lead program kicks into action. And so it's a team of a environmental health sanitarian and a community health nurse, and they will do education and do home visit with the family. They also bring in a privately contracted company that we work with to do that full lead assessment of the home, and they go from there in making remediation and ensuring that child's blood lead level decreases. And so we deal a lot with lead as well, and it'll come up in one other area. And then Children with Special Care Needs is a mandated program of the state, and I, again, wanted to point it out because of this. Their biggest program is around early intervention with children 0 to 3 years of age, and that's also when we're seeing lead issues come up and other issues that may very well be a result of their environment. And as we all know, the home is where we spend a ton of our time, and especially little people. So, and then administration is sort of a catch-all. My program is in there, health promotion, which does a lot of education, outreach, community planning for the county. And we have some grant programs as well, like the Healthy Neighborhoods program that I'll talk about later, tobacco control that I wanted to point out because one of their big initiatives is around smoke-free housing. Another element of the environment that really impacts the health and well-being of people, especially in multi-unit buildings. And so across the state, there's been, and actually nationally now, because HUD has gone smoke-free, that big changes in multi-unit subsidized housing, and so around no longer allowing tobacco smoke indoors. And then there are a few other things listed there. Okay. So those are what I just went over with these divisions of the health department. They're really, and especially the regulatory aspects are really considered these core functions of public health, and really put in place a long time ago to protect public health and well-being. And as we've progressed over the years, a lot of the foundation of what we're seeing causes, positive health or challenges to health lies in these drivers and determinants of health, and sort of these root causes that have already been discussed by my colleagues. And so while these have been around and knowledge about them for a long time, the traditional role of the public health department has not too intentionally felt like we have been addressing these. And so moving forward, at a national level and state level, this is more in the forefront, which is great. And so I wanted to quickly show you this image of that gives you a little history of public health, but right now we're very interested in this idea of public health 3.0. But to take you back, Public Health 1.0 can be deemed as like turn of the century, when our public water systems were first put in place, sanitary conditions were really improved, our vaccinations began, and then Public Health 2.0 was more about formalizing these core functions of local health departments. And then Public Health 3.0 is moving beyond these core functions and really a focus on population health that addresses the full range of factors that influences a person's health and well-being. And so at the national level, at the Institute of Medicine and NACCHO, the National Association of County and City Health Officials, they've written about what this new role of local health departments should be. And so some of those ideas are listed here, that there are ideas about the health department serving in a strategy capacity, really convening multi-sector partnerships, and using data to address these social determinants of health and health equity. And there's always stuff about having adequate funding for public health, which has never been achieved. So I wanted to move on to how this is impacting us here at the local level. And so, and it's leading towards more opportunities for us to address housing in different ways than we are currently. So at the state level, the New York State Prevention Agenda was revised about a year ago, and that is really the guidance that we use for developing some of our planning documents. And so this revision now really has an emphasis on social determinants of health, and some of the language has changed around the priorities that are addressed to include terminology such as well-being. And so we've been using that to develop our community health improvement plan and conduct our community health assessment, which we're just wrapping up now. And this round of our community health assessment, which is done about every 5 years, we really made an effort to more heavily engage the community input. And so we did a community health survey, and we did focus groups and some stakeholder interviews. And in order to inform the secondary data that we were also looking at. And so I'm going to show you an example of that in a minute. And as part of this, we also have been thinking about other ways to align and coordinate with other county government agencies, such as planning and Office for the Aging, and also other partner organizations, nonprofits that we work with, to really review their plans and priorities and strategies for the next couple of years and make sure that we're all in alignment. And we also plan to do more of an inventory of screening tools around social determinants of health that are being used currently in the county and what we could do differently, and make sure that we're able to see how we can close the loop on the referral processes around those. And lastly, I just wanted to mention that the health department received a grant this year from the Kresge Foundation that also was very focused on this Public Health 3.0 and the future role of local public health in communities. And so it's allowing us to embark on a strategic planning process over the next 6 months or so that really will be reframing us and getting us on track to more intentionally be addressing social determinants of health in our work. So I wanted to bring up one example of the qualitative data that we collected through our community health assessment process. So this was from the survey that we did, and we asked residents to rate their perception of their health across 4 dimensions, so physical, dental, mental, and their overall health. And in the initial questions, people rated their health fairly good. But then what was interesting is that when we cross-tabulated against what people rated their personal health as compared to questions that asked them about different determinants of health, such as transportation access, food security, and housing, that there's where we saw a lot of differences. And so most of this is not very surprising, but it was shown by this small sample that we had, which was about it was a little over 1,000 people who responded. So up here we have when people were asked to rate, or they were rating their health on other questions, and then this is showing the income, that it's showing that those who have lower income rated their health poorer. And then also housing type, those who are in subsidized housing or homeless also rated their health in having worse health. And so we saw this for questions about education attainment, also transportation issues. So, and we had some questions about neighborhood safety, and that also was impacted by where people were living, and how they felt about their perception of health. So, so we are compiling this, and we'll be finishing up in the next couple months. So I wanted to give this example of a grant program that we have at the health department, the Healthy Neighborhoods program. It intersects with what both Nancy and Katrina are speaking about, because it is addressing the physical environment inside people's homes throughout the county, but then we also are seeing a lot of mental health issues and other factors that are coming into play about, in relation to the housing quality. And so the goal of this program is really to decrease the burden of housing-related illness and injury. The grant is awarded from the State Department of Health based on age of housing. And so, for example, in our county, we have probably a little over 60% of our housing was built before 1980. And in the city of Ithaca, it's probably higher. It's about 80%. And so the 1980 or 1978 is also when lead paint stopped, was no longer being used as prevalently. And so it's a good estimate of, that old housing stock and the many different issues that that can be contributed to it. So, and then it's also, there's a focus on asthma in this program and addressing asthma triggers indoors. And then we also, some of it is based on socioeconomic factors, but there's pretty low threshold for this program. So it involves home visits, and we're able to provide education and home safety products to folks. And we also do an initial lead paint assessment that if that's needed. So we work closely with our lead program. So it's really meant to be around prevention, and it's not a regulatory program, which again, sort of lowers the threshold of people participating and getting the information. So lastly, I just wanted to mention that as the health department moves forward and as we think about this in our communities, we really feel like the health department is interested in getting more involved in housing, but we also know that we have our certain roles and responsibilities, and that we, in order to really address the issue, that we need to work collaboratively with our partners and multi-sector partners. So I wanted to just bring up collective impact as a model. We have collective impact work going on here in the community. One example is this Childhood Nutrition Collaborative, and these are some of the tenets of collective impact, but a lot of it is around having common measures and shared goals, and continuing to build relationships together to address these larger societal issues that we have that are impacting people's health. And so I'm going to end so that we can move on. But I wanted to pose back to the audience, and perhaps in our discussion we can think through, if models such as this is something that we need to apply to housing, and any other suggestions or ways that that local health departments are involved in supporting housing and neighborhood development. Thank you.
Thank you. I'm also going to say that, at least from our perspective, from foundations and philanthropy, we also use a collective impact model. I know that a lot of coalitions do, as well as health departments, so I think that is a model that's being used across a number of neighborhoods and a number of communities. I know Robin is walking around, so if anyone has any questions for our panelists, we'd be more than willing to entertain those. And I see there are a few, so I'll pass the mic to whoever you'd like to hear from.
So I know that there's a session on climate change, but are you starting to look at the specific impacts around climate change and either housing conditions or the health pieces? And I'm thinking specifically about housing temperature and also, quite frankly, housing flooding outside of floodplains in terms of this housing impact, because I think that's coming at us a little bit faster than we may have anticipated.
So a lot of communities are working on climate action plans, climate vulnerability assessments, and climate resilience plans. And the guidelines from DEC to do that don't explicitly call out health, but we overlaid a health equity analysis on our climate resilience plan, and sort of through the participation process worked that into the climate action plan really strongly as well. So I think that the climate resilience plan that Rochester should be finalizing within the next couple of months might be a good model to look at for how to do that.
Yeah. And I do have one other addition to that. So as people are looking at housing interventions and they're doing things in the home, there is some guidance on ways to, like if you're replacing a furnace, it might not be best to put it on the floor of the basement, but it may be better to either hang it from the underside of stringers or to place it in somewhere that's in the first floor so that it's not affected by flooding. So there is more and more guidance coming out about that as community and neighborhood organizations are actually doing those housing implementations.
This is excuse me, this is a question for Nancy about the relationship of housing mobility to health. We're finishing a study of evictions in Buffalo. About 13 to 14% of rental households in the city of Buffalo get evicted each year, and that's court evictions, so just a fraction of all the households that have to move involuntarily for one reason or another. And I noticed some literature about the health impacts of that and mental health impacts, but I'm wondering if you've looked into that at all or have any thoughts about that.
Thank you. I haven't studied that directly myself, but my sense from the literature is that it's really kind of a dual issue of the sort of insecurity, the vulnerability of feeling unsure if you are going to be able to stay in your home, as well as the disruption when you do have to relocate. And when we think about children in particular who maybe are going to, several half dozen different school districts in a year if they're having to move a lot. So it's a multifaceted impact on a family.
Hi, I work in rural and suburban communities. This is a question primarily for Dr. Wells. When you talk about green space, are the studies going into detail of what type of green space? Our rural communities are surrounded by green. Does not help with the feelings of isolation. We have more nature than we know what to do with, but we can't access it. Are the studies taking this into account, or are they more in an urban kind of focus?
The studies are pretty variable. So some of the studies are really at kind of a close scale, like exactly what are the characteristics of the natural environment, or how much nature is there right around the home. But some of the other studies, and I kind of alluded to the fact that some of the studies in the last decade or so are coming out of epidemiology, where they're looking at these huge samples of 250,000 or 2 million people, the entire population of England. And so they're looking they're using GIS, Geographic Information Systems, and they're really looking at a very gross indication of what is nature. So there's some mix, but I think really what you're touching on, this idea of what kind of nature do we need, is not super clear in the literature. Some of the studies are about views of nature. I think that's a good thing to pay attention to, especially when we're talking about cognitive functioning. So if you're thinking about, where you put your desk or where you put your kid's desk, trying to have a green view, or if there isn't a tree out there and you have the capacity to plant a tree so there will be a green view. So that's one little nugget to think about. I think also the idea that nature, I sometimes talk about nature as being kind of a social magnet. Nature can draw people together and help to increase community connection, social support. So trying to think about the configuration of the natural environment so that it does kind of function in that way. And that it kind of relates to things like parks and greenways. We didn't really talk about physical activity and obesity, but I think that's kind of a related thread. And sometimes, although we think about rural environments as being so green, if they're not kind of configured in a way that's usable and accessible, they might not be achieving all the kinds of health outcomes that they could. So I hope that helps.
Hi. When we're dealing with home health hazards, we're obviously, the prevalence is in rental stock, right? And so we have some great programs with the Section 8, the Housing Choice Voucher, where there is an inspection requirement before any tenant moves in. But what is often unnoticed is that the county Department of Social Services often are investing millions of dollars, public subsidies to our private rental stock. And Monroe County, I know, is one of the few where you've actually required inspections. But I'm curious, does anyone else here know of counties that are also doing that, requiring inspections? Because usually counties just say, we have no capacity to do it, it's not our responsibility. The local code office says no, but I mean, literally millions of dollars, public tax dollars, are going into these rental properties that are harming tenants and residents.
Times. Orange County, New York was actually sued by the landlords, and they cannot withhold Section 8 based on any sort of city inspection. They can do their base level first inspection, but they can't compel the city to do an inspection just to meet minimum building code. So we're a little handcuffed by that.
That's odd. I never heard. I mean, there is the Spiegel Act, and I know a lot of the municipalities that have been funded through the AG Enterprise Office with City Rise are exploring more effective use of the Spiegel Act. That's surprising, but I was just curious if there was any other county, or if someone knows at the state level, like, this is the one time I would welcome a state mandate, as long as it came with actual resources, considering they're hoarding our code enforcement dollars. But do any of the panelists up there know of any movement at the state, maybe?
Or anybody else in the audience?
We've found that, and I've researched this a little bit, that you need a DSS commissioner that wants to be an activist, essentially, and ensure that the dollars that they have to spend on housing go towards safe housing, essentially, healthy housing. But at least every DSS commissioner I've talked to views their primary mission as getting people off the street into housing, and a lot of their funding is based on that emergency basis. So we've looked at it. We know that in our small community, the largest pool of dollars that goes towards housing flows through the DSS, but our commissioner is frankly just kind of a long time ago has thrown up his hands and said, well, that's not my mission, essentially.
So I just wanted to add that, so lead is just one small part of that, but that I tried to make the argument that's something you can hang your hat on, right? Because it's easy to measure, it has clear health outcomes. And right now, actually, there's a conference call going on by a statewide group that is drafting an omnibus lead prevention bill that is already introduced, but it's getting boosted up this year, and building on the governor's apparent enthusiasm for putting lead inspections in the budget bill last year. That wasn't passed, but we're hopeful this year that we'll get this comprehensive lead bill through, and that would require at least lead inspections everywhere. And one of the things that Heidi put on the website, I think, for this is an article that we wrote sort of giving an overview of the lay of the land and where we hope to go with that.
I guess the last thing I'll add, well, two things. One is that we do work closely with our Section 8 inspectors, even through the Healthy Neighborhoods program. And we've had, I mean, it's been case by case where we've had situations where we've been able to have Section 8 come back and do another inspection or write a letter to the landlord. But it hasn't been overarching and broad enough. And then as of October 1st on the state level, the blood lead level, the action level has decreased. And so this is having real impacts on our lead program to be investigating blood lead level cases that are significantly lower than they have been in the past. And so that we'll see that that's going to lead to more full lead inspections happening at homes. But again, lead focused. And so we'll see what comes of that.
I'm going to say a lot of the coalitions that start out with lead move towards healthy housing, or additional coalitions start related to healthy housing, because I think that they all recognize, they go in to do lead and you see pests and leaks and mold and asbestos and all of these other things. So I think there is kind of a national trend to move towards a more healthy housing model, not just one individual health risk or assessment. So that's at least the direction things are moving, which is good, I think, for a lot of housing agencies.
My question is with lead poison. You will notice that from the presentation, the coalition goal is to eliminate lead poison by 2010, and we are in 2019 now. So are they still maintaining that same goal, or there is going to be a review of that goal? And what is the current data statistics with regards to the years showing results of such nature?
So obviously we didn't quite meet that goal, but we got really close. And I actually don't know if they replaced it with another number because the definition of lead poisoning has changed. So at that point we were considering kids with a blood lead level of 10 or above, and now we're considering 5. And actually the CDC has recommended 3.5, but the current administration isn't supporting that.
Hi, I'm Jacob, Code Enforcement for the City of Geneva. Something I find harder than lead to track is bedbugs. We don't really have a lot of tools. It's, again, one of these things that people don't like to talk about. There's obviously the mental and physical impacts. So just wondering what input we could have from the panel on that.
Unfortunately, I know too much about bedbugs. So yeah, it's a real gray area and a difficult challenge in our community here, but I know many others. So we're, we haven't studied it, but I mean, we see that people who are dealing with bedbug infestations are certainly, have many other barriers that are affecting their lives. And so the health department, though, unfortunately, can't fully address it either because bedbugs do not fall into our sanitary code, and so because they haven't been proven to cause disease. And so this is then this really tricky issue because we've talked to our code enforcement or bounced back and forth, but it's for code enforcement, it doesn't seem to fall under the same pest infestation as rats and mice, for example, and cockroaches. And so it's been a real a difficult area. I'll again go back to our Healthy Neighborhoods program has sort of stepped up to at least provide some assistance to residents that we have information and education to give people, and we have purchased some products through our grant that address bedbug issues like passive monitors, and we have vacuums and we have cleaning tips. And so it's something, but by the time people are calling us about bedbugs, they usually have a full infestation. And it's also really difficult in multi-unit or multi-roomed housing that it's not just confined to the one apartment who calls us, that it's through the whole building. So we've certainly had conversations with landlords if it's a rental situation, but there's no enforcement that we can take. So it's challenging.
Hi, my name is Christine Shipley, and I work for the City of Watertown. I'm a BSI. So I go into many of the houses that have the bed bugs, that have the lead paint, they have the issues as these two gentlemen have spoke about. We do have a rental registration, but being a code enforcement officer and a BSI gives us limitations that we just can't walk into a property without the permission of the landlord or basically the tenant. So what I'd like to know is, where's the education? I think we should have more monies going towards education of these tenants and landlords to say what their rights are, because a lot of times if you walk in and you see that because of the lead paint and you're seeing the mold and you're seeing the leaks and you're seeing that the fire safety is not properly installed, that tenant has to call us. And that's where I'm hoping that you guys are educating these people in order to call us to make these wrongs right. And that's where my liability is, that's where my jurisdiction is. And even in registration of rentals, we can only go into the common areas unless we're invited in. So I just want to know what you're doing to educate people in order to contact the right people to get things fixed.
So I think the Healthy Neighborhoods program is clearly one for the communities that have that. There are lots of materials that work at a national level, but one of the challenges about healthy housing is it depends, right? What kind of community you are in, what kind of housing stock. And the other dynamic that is really a struggle is there's the house and there's the residents. And clearly the management, the behavior of the residents and the management of the house need to be coordinated. And the way that we have organized that is we have one group that's really focusing on housing solutions, providing grants, technical advice, aligning those resources, and another group that focuses on the human side, so coordinating the programs that do home visiting and all the educational materials, but making sure that there's a really close connection between those two. So we're not wasting people's time, but we're making sure they're really closely aligned. We have lots of things on our website that we think are pretty good for most of New York, and I'll be happy to give you that afterwards, particularly through the Children's Environmental Health Centers. If you can keep a house safe for children, it's going to be safe for everyone. So I think that would be useful. But there's one particular material I'd like to offer to everyone. We have had that observation as well, talking to tenants, saying, if I knew that I had rights, it would have been a different story. Now that I know there's this thing called a lease, it's a whole different world, and I tell all my friends about it. And the problem was that although a lot of the legal aid organizations have materials about tenants' rights, they tend to be really, really dense and very, very particular to specific situations. And no offense to the lawyers in the room, but the lawyers are the wrong people to be giving that advice because it's also complicated for them. It comes out being 17 pages of dense text. So we have a one-page infographic, which I think makes a lot of our lawyer friends' hair curl a little bit, but they were okay with. And then we have a two-page sort of brochure for service providers that we think is just about the right level for those two audiences. And I can show you where on our website that is. You're welcome to steal it. I'll give you the source files if you want to brand it. We're happy to share that with others.
I'm going to add one other thing. I know that Syracuse and Utica just recently hired through their legal services of Central New York a community organizer specifically to go out into the community to discuss issues of landlord retaliation, tenants' rights, and those types of things. So there are, I think, resources being deployed that you can look at to copy and use as models. I want to thank our panelists. One more question?
One question.
Okay. Oh, Lenny, yeah.
Yes. Hi, Len Merritt from the city of Rochester. I just have one question. A few years ago, I read a study concerning vacant housing, and this is something that may go well with our zombie properties here, is that there was a study that was done on the adverse health effects of vacant properties as well as vacant lots next door to tenants, and that it created that kind of, one of the things I read was even it raised the blood pressure rates of those people that live next door. So is there being pressure put on anyone in the state that can help to put more resources to the zombie properties that can show from those studies that there is cause and effect relationship with those vacant housing houses that are next door to those properties?
Well, I have a related comment, but maybe my co-panelists will have an answer in terms of the state level question. One of the studies that I didn't mention, but is a little bit related and maybe a kind of an optimistic perspective. There's been a series of studies done in, I think it's in Pittsburgh, looking at vacant lots and the greening of vacant lots. It's really an interesting study where they randomly assigned the lots to be sort of greened or not. And they found, so basically they just kind of tidied up these messy lots, cleaned up the litter, put up a little fence, not even like not a big chain link fence, but kind of a friendly little fence that kind of communicated a sense of territoriality, like this is somebody's space and somebody cares about it. They planted some grass. It was pretty simple. And they found significant effects on a variety of health outcomes, I think including some mental health outcomes and maybe something about gun violence as well. So it was done by Charles Brannis as the lead researcher on those projects. So anyway, that's just a little nugget kind of related to this issue of vacant lots. That, it's not free, but it's kind of a low-cost intervention that might help. And I don't know if these guys have something to add about policy.
Detroit has a whole plan around that too, about greening lots. But I actually was going to sort of take Len's question, turn it back to him, and relate it to the themes of the conference, that academics are kind of the worst people to answer that question because, as you know, we are very siloed and very disciplinary. So if you talk to someone in the health professions about healthy housing, they want to know what is the condition in that particular house that affected that particular kid or that particular family. And then they say, oh, people move. It gets very confusing. And you know from common sense that these health effects happen at a neighborhood scale as well. So the lot next door, the house by block. And the answer, of course, is common sense. It's both. But don't look to academics to do that work. I think it really needs to be people who are practicing and trying to develop policies and say it's not okay to just say, we can't make a house-by-house connection. It really works at both levels.
All right, on that note, I would like to thank our panel for being here today, and I just want to end on a thought of it's always better to prevent someone from getting sick than to pay for the long-term social costs of what that illness might end up costing us as an entire society and taxpayer. So,
thank you, Caroline. So.